Good morning, everyone. My name is Collie Winter, Director of Spa for Edgeless Beauty Group, which also includes me being a regional educator for Ultraceuticals. I'm so happy that you are going to be here with me today while we go over Ultraceuticals' new LumiZyme peel. The Ultra LumiBright Brightening Peel is something that has definitely been needed in the network. Anyone who is experiencing challenges with, say, acne scarring or hyperpigmentation or aging along with some pigment challenges, this is definitely the peel for you. Today, we're going to be covering mechanisms of peeling, the Ultra Lumi Bright Brightening Peel, the treatment itself. We're also going to be going over some key ingredients and contraindications in pre and post care, along with clinicals and testimonials. This material is intended solely for the use of clinic and salon professionals. So basically, if you would like to take screenshots of any of this material for your learning purposes, feel free to do so. However, we ask that you don't share those screenshots on, say, your social media, things like that. So let's start by talking about the three mechanisms of peeling. The first mechanism is exfoliation. So exfoliation, we know, is key for the skin to have less of a rough texture, for it to have more of a brightening glow, allowing that stratum lucidum to shine. Having that glazed donut skin, we know that exfoliation is important. Now, there are different types of exfoliation out in the field. There is mechanical exfoliation, which is a scrub of some kind, meaning you have to mechanically move it around for it to remove surface dead skin cells. That could be a facial brush, that could be a product that has grit to it. That would typically be mechanical. We are talking about biochemical exfoliation here. Biochemical exfoliation, of course, there's BHAs, AHAs, and enzymes, and each one has a different purpose in exfoliation with the skin. BHA would be more like a salicylic acid. AHA ranges anything from a glycolic acid peel to a PHA peel. All of those peels and everything in between is considered an alpha hydroxy acid peel. And what an alpha hydroxy acid works on is those corneodesmosomes. Okay, so when your skin cells are happy and healthy in the lower portion of the epidermis, aka the basal layer, they're bonded together with something called desmosomes. As they start to work their way up, they start to dehydrate and shut off. As they're starting to dehydrate, they're squeezing out all of those healthy oils, they're squeezing out some hydration, and then now those desmosomes are turning into corneodesmosomes, and that is what an AHA is really good for, because it helps to dissolve those corneodesmosomes that are holding those skin cells together so that they aren't able to shut off as quickly. And we want our skin to renew itself a little bit faster, particularly if we're trying to treat acne scarring, or if we're trying to treat, aging that could be taking place in the skin. We want that cell renewal to take place. Oh, and of course, if we're trying to treat pigment. Now, the challenge is we want to make sure that we're exfoliating properly so that we aren't causing more pigment. So I always like to bring up the Fitzpatrick scale. So the Fitzpatrick scale is the amount of melanin that one might have in their skin. So a level 1, 2 would be what you're seeing in my skin, where a level 5 would be someone who has more melanin in their skin, so a little bit more of that pigment. My skin, when it starts to have inflammation, you can see it. It shows up as pink, it can show up as red, where a darker Fitzpatrick shows up as brown or even black, and that would be called hyperpigmentation. So that is the difference, and that's why you want to be careful on the different peels that you're providing for guests based off of their Fitzpatrick. So Exfoliation for desmosomes. Desmosomes are specialized protein complexes within the skin's epidermis that act as cellular glue. So as I was describing before, when your skin cells are trying to do their shedding off process and dehydrating and starting to die, and that nucleus in the center of the skin cell dies, if you have corneal desmosomes where they're bonded together, it can't shed off properly. So that is what an AHA is doing, is it is assisting with dissolving that cellular glue. They maintain the skin's structural integrity by forming strong adhesive connections between cells. In the stratum corneum, desmosomes gradually break down during the natural desquamation process, allowing dead skin cells, aka keratinocytes, to shed, making way for new cells. If this process is impaired or slowed, dead skin cells accumulate, leading to a dull complexion and uneven texture. Chemical exfoliators dissolve the desmosomes, holding on to dead skin cells on the surface of the skin, allowing them to ease the way. The next mechanism would be brightening. Effective melanogenesis suppression involves a multifaceted approach that targets the entire melanin production pathway, including reducing melanin production at its source by inhibiting key enzymes like tyrosinase, suppressing melanogenesis signaling pathways, enhancing results by preventing the transfer of melanin from melanocytes to keratinocytes, and providing antioxidant protection, which can exacerbate pigmentation. So basically, in a nutshell, in the basal layer of your epidermis is where your melanocyte lives. And your melanocyte carries two things within it, melanin and tyrosinase. When you have inflammation occurring, so from external factors, it can be the sun, it can be improper skincare, it can be us picking at our skin, it can be us over peeling the skin, over exfoliation, causing inflammation from the outside, or also, one more thing, when your barrier is compromised. Internal could be hormone imbalances, it can be you're going from being a teenager to an adult, or going from a child to a teenager, or it can be maybe perimenopause or menopause. There are multiple things that can cause the body to have imbalances with hormones. So that is definitely a big one. Another one is stress. Stress causes an inflammatory response in the body. Also, another one is improper diet. Now, we know all of us have different constitutions, which are going to make certain foods a little more inflammatory producing for you. And each one of us knows what those things are. And sometimes we choose to listen and sometimes we choose not to. So those are your internal factors and your external factors that can cause inflammation. When inflammation is present, it stimulates that tyrosinase enzyme. And when you have too much of that enzyme, you produce more melanin. So that enzyme is the trigger for you to produce more melanin. Then you have more melanin that turn into melanosomes, which are kind of like the little arms that go in between your skin cells. Eventually, that melanin goes into the center of your keratinocyte, so your skin cell. There is not a product out there that can get into the center of a skin cell. So that's why pigment is so hard to treat. And one of the best ways to treat it is speeding up that cell turnover so that skin cell that has been taken over with the melanin can then do its shedding off process. But you have to do it correctly and you have to do it with the correct skin type, or else you can cause more inflammation, right? And then that's what's causing it to begin with. So you want to make sure that you're doing the correct peel on the correct skin type. The last one is hydration and repair. Of course, we know that peels are creating a micro wound in the skin, so that hydration and repair is so important to prevent other damage damaging mechanisms to take place. So definitely having a healthy barrier, one, makes you absorb that peel better because you're not already inflamed and irritated. And two, it protects you from further damage. So restoring the moisture barrier reduces transepidermal water loss, while soothing ingredients minimize redness and inflammation. Additionally, repairing the barrier helps maintain long-term skin health, enhances the efficacy of the peel, and ensures a smoother, more radiant outcome. Sodium lactate and niacinamide enhance the skin's moisture barrier, keeping it hydrated, plump, and rejuvenated after exfoliation. So we want our skin cells to look nice and hydrated like a grape versus plumped, or nice and hydrated and plump like a grape versus shriveled up like a raisin. And that is what hydration does. And when you have a healthy hydration barrier, it protects that. So it prevents you from losing that hydration quickly. Now let's dive into the Ultra LumiBright Brightening Peel. These are some of the key ingredients in this beautiful peel. So we have a 26% glycolic and citric acid, along with a BHA. Now, Ultraceuticals does not use a salicylic acid that's over a 2%. Anytime you're using a beta hydroxy acid that is over 2%, it makes it contraindicated for pregnancy. So because this is under 2%, it is safe for pregnancy. We also use tranexamic acid, niacinamide, and sodium lactate. As we were just talking about a few minutes ago, niacinamide and sodium lactate help to prevent moisture loss. It also helps to plump and hydrate the skin, and it helps to support that barrier where tranexamic acid, glycolic, and citric acid, along with beta hydroxy acid of salicylic acid, are performing the exfoliation. This peel is safe for Fitzpatrick's 1 through 4. As I discussed previously, doing this peel on a Fitz 5 or 6 could stimulate more melanin production. And if they're trying to treat that, one of our recommendations would be to do the LumiZyme alone, along with doing a BAM, a brightening accelerator mask. That makes that treatment definitely safe for a darker Fitzpatrick. This treatment instantly leaves the skin looking brighter and more firm, instantly leaves the skin looking visibly more luminous and glowing, instantly smooths the skin texture and leaves the skin looking visibly polished, and instantly hydrates the skin and leaves the skin feeling supple. Again, it utilizes a powerful complex of AHA and BHA to accelerate revelation of fresh, new skin. Exfoliates the skin surface to help visibly diminish and reduce the signs of aging. It is a pH of 3, and it is for combination, oily, normal, and dry skin types. It is dermatology tested and known to be non-irritating to the skin. This is going to treat primary concerns of discoloration, skin lacking luminosity, and dull and rough skin texture. The LumiBright Peel. This treatment for dull or discolored skin, you're going to be using 3/4 of a teaspoon of that brightening peel, and you're going to apply it in 2 applications. So you apply half of the peel with your fingers, with gloved fingers, and you're going to start on the forehead, and you're doing small circular friction type movements to massage that peel into the skin. Now, as you start applying it on the forehead, you want to do that discomfort check-in. So on a scale of 1 to 10, where is their discomfort? Now, we ask that a guest gives us a true number, because if we just say, how is your skin feeling? They're going to say fine. And that doesn't really give us a true gauge on how their skin is responding to the peel. So we want to ask, are you a level 2? Are you level 3? If they are reaching 5, then we want to monitor it. If they are over a 7, then we need to remove it. This means their barrier wasn't strong enough for this peel, or that it was just not the right time for them, or it could be having a reaction to one of the ingredients, even though that is unlikely. So the procedure consists of cleanse and prep, peel application and removal. So again, you're using 3/4 of a teaspoon and you're applying it in circular friction starting on the forehead. Before you move on to the next section, you're going to want to check in with that guest on that discomfort scale. Once you have reached 5 minutes, you apply the remainder of the peel and you manipulate it around. This peel should be on the skin for about 10 minutes. And you want to make sure that you stop manipulating it once it gets a sticky texture. So maybe it starts getting sticky within 1 minute. So then I let it sit for the remainder of that first 5 minutes before I apply my second application. Once I apply my second application, again, I manipulate it with circular friction and, excuse me, once it starts getting that sticky texture again, I stop manipulating it and let it sit for the remainder of that 10 minutes. You're going to remove with disposable moistened cotton pads, and usually it takes about 2 to 3 swipes of removal to remove the entire peel. You want to make sure that there isn't any peel left on the skin before moving into the next step. Optional, you can boost with a BAM, which is that brightening accelerator mask. Optional, you can infuse correctives into the skin. So Ultra A, Ultra C, Ultra B, or hydroxy acids. Another is performing a mask. So optional, you can add on the B² hydration mask, or you can do a layer where you're putting B² serum with B² recovery cream over the top in a thick fashion. That is a beautiful post-peel masking option. Another one is doing a mixture of replenishing mask and B² serum, or a mixture of B² recovery cream and replenishing mask. All 3 of those masks are beautiful to repair that hydration, to get that hydration in the skin, to prevent any damage from occurring from the peel. Then, of course, you're going to use your finishing products. So you're going to use moisturizer, antioxidant, and sunscreen. The treatment plan is, it is recommended that every 2 weeks you do a peel. You're going to have optimum results in treating hyperpigmentation or acne scarring, or maybe there's some aging that's happening in the skin. If there is something that has been there for a while, then it's more likely going to take more than 1 treatment for you to get results. So if you do 1 treatment every 2 weeks for 4 or 6 treatments, that's when you're going to have optimum results. And then, of course, home care. We want to make sure that they have good home care as well, which we're going to talk about in just a moment. So a treatment journey overview. It is recommended for treating dull or discolored skin that in the first treatment, you do the Ultra LumiBright peel along with a BAM and infuse 1 corrective into the skin and a performance mask. The second treatment could consist of Ultra LumiBright peel plus a BAM plus 2 correctives. So now you're infusing 2 correctives into the skin. So again, you're layering them. You aren't mixing them together. So if I wanted to do B² and I'm infusing that into the skin, and then I wanted to do, say, Ultra C, then I would infuse that into the skin next. And then, of course, there is a performance mask that you can infuse into the skin. So if you have replenishing mask or recovery cream as your performance mask, you can infuse that into the skin with your Sono Booster. Then we have treatment 3. Treatment 3 can be the LumiBright peel plus a brightening accelerator mask plus 2 corrective serums. plus a performance mask. Home care recommendations is that you use the Ultra Brightening Cleanser, Ultra Skin Mist, Ultra Eye Cream, Ultra Brightening Serum Mild, Ultra B Squared Hydrating Serum, and Ultra Brightening Moisturizer, along with your Ultra Protective Antiox and sunscreen. It is recommended in the second month you introduce your Ultra A Perfecting Serum, mild. So you always want to start with mild. And then by 3 months, you will have introduced the brightening serum, B squared hydrating serum, Ultra A perfecting serum mild for your evening routine. And then for your daytime routine, you have your Ultra C firming serum. There is the Ultra Glass Facial. So incorporating the Ultra LumiBright Peel, you again would do your double cleanse and prep. You would do your peel application in 2 to 3 layers. Then you're adding the LED light therapy, infusing a corrective into the skin, your Ultra B Squared hydration mask, and then your finishing products. This makes the skin look like glass. It is a beautiful treatment. Again, your journey would be your peel, LED light therapy, your corrective infusions of AC or brightening, and then your Ultra B Squared hydration mask for the face. Next treatment could be Ultra LumiBright Peel for 15 minutes, LED light therapy, 2 corrective infusions of AC or brightening, and then Ultra B Squared hydrating mask. Then your third treatment can consist of Ultra LumiBright Peel for 15 minutes, LED light therapy, and corrective infusions, A, C, and brightening. Ultra B Squared hydrating mask for the face. So these are all beautiful treatment options with the LumiBright Peel by itself. Now let's talk a little bit more about the LumiZyme or the LumiZyme. LumiZyme is incorporating the LumiBright Peel and the Zyme within a treatment. So I'm just going to stop sharing my screen here. Let me see if I can. Okay, so the LumiBright. Another thing that I wanted to share with you is in the chat of this call, I did put the latest USA menu suggestion along with the Power Peel protocols and the performance facial experience. So all of those are in the chat, so you have access to those. Okay. Okay. Let me see if I can get this pulled up quickly here. Okay, so I know I have a couple people on the call with me. Can you come off of mute and let me know if you can see my screen of the Power Peel protocols?
Not currently.
Okay, let me see if I try it again. Okay, how about now?
Yes.
Okay, so this is the Power Peel booklet that has all of the peels in it. So I wanted to show this to you This would be the Ultraceuticals Power Renewal Peel, which is just the peel by itself. So if you were ever going to do the Azyme alone, this gives you all of the steps for that treatment. Then there is the LumiBright Power Peel, which is what we just went over. And then if I keep scrolling down, we have our Ultra Mandelic Clarifying Peel, the Ultra Lactic Hydration Peel, the Ultra PHA Calm and Restore Peel, the Ultra Brightening Accelerator. So that would be your BAM, your Brightening Accelerator Mask. So all of these are options for performing different peels. Now, when we're talking about the LumiZyme is considered a stacking method. So what that means is we are going to be doing a brightening peel that has all of those amazing AHAs, BHAs within them, along with some hydration properties. And then you go right into doing an Azyme directly after. So here is the protocol for the LumiZyme. So the LumiZyme, again, is for Fitzpatrick 1 through 4. The treatment time is 40 minutes. And you're going to do a double cleanse. So your first cleanse is going to consist of the calming cleanser. Your second cleanse is going to consist of utilizing the brightening cleanser or your ultra balancing gel. And you're going to remove that first layer of the cleanser with your Sono Booster and then remove with either aromatic steam towel or pre-moistened disposable cloth. Then you're going to dispense 1 pump of your pre-peel skin preparation onto cotton pads and pass across the skin using the Sono Booster. So basically you have your pad that has the peel prep and you do a wipe and then swipe with your Sono Booster. You do a wipe and then swipe with your Sono Booster. And what this peel prep is doing is it's removing any excess oils or ensuring that there isn't any cleanser still left on the skin so that way the peel can penetrate evenly. The next step for your cleanse and prep is your Ultra Eye Moisture Cream. You're going to apply this to the orbital area around your eyes as well as apply it to the lips because that skin is thinner than the skin on the rest of your face. And so you want to make sure that you're protecting those areas really well. Next, you're going to apply the first treatment, which is 3/4 teaspoon of LumiBright peel. You're going to apply half of the peel and massage gently for 5 minutes, just like I was describing with the LumiBright peel by itself. Once it starts to get a sticky texture, you stop manipulating it and let it continue to sit on the skin for that remainder of 5 minutes. Then you're going to add the remainder of the LumiBright peel, massaging it into the skin with gloved fingers. And then once it starts to get a little bit of a sticky texture, you stop manipulating it and then you let it sit for the remainder of that 5 minutes. So this peel will be on the skin for a total of 10 minutes. Then you're going to remove with a pre-moistened disposable cloth. And then from there is when you are going to apply your Sono Boost infusion. So this is when you're going to infuse into the skin your Ultra Brightening Serum. You can continue in lead mode if you would like to infuse the Ultra A Booster as well. But remember, if this is the first time that they are having a peel with you, it's recommended that you would just do 1. So instead of 2 infusions, you would do 1. Next is when we're going into the Azyme peel. Combine in a bowl an entire Azyme base of a syringe with 1 ml of your activator. Now, I've seen this has happened before. You can get up to, I believe, 5 Azyme peels per activator. So in that activator, it comes in a a dropper, and on that dropper, it's 0.5 mils. So that means you would do 2 full droppers of your activator and you mix it with the base. Now make sure you don't mix it until right before you're getting ready to use it, because the enzymes that are in the azyme, if it sits for too long, they can start to kind of eat at each other instead of dissolving dead skin cells. Now we know that an enzyme versus an AHA or versus a BHA, that's exactly what it does. An enzyme only eats dead keratinocytes. So it doesn't dissolve corneodesmosomes. What it's doing is it's eating away at any keratinocytes that no longer have its nucleus. So this is why this is such an amazing treatment, because you have your LumiBright peel with that glycolic, with that tranexamic acid, and with those beautiful hydrating ingredients of niacinamide. And then you're coming through with your azyme to make sure that there isn't any dead skin cells remaining. You're going to infuse the azyme into the skin with your Sono Booster in infuse mode for up to 10 minutes. So it looks like a dance. You know, you're massaging with one hand and you're infusing with the other. So it's just a massage, infuse, and you can do this for up to 10 minutes. You can infuse for that whole time if you would like. I typically infuse into the skin for about 5 minutes, and then I'll just manipulate with my fingers just to give a second texture, a different experience. Next, you're going to remove your azyme peel with pre-moistened cotton, and then you're going to apply the B squared hydration mask. Now, if you are going to be doing the brightening peel and the azyme peel, it is important that you also add the Ultra B squared hydration mask. You're going to apply the Ultra B squared hydration mask and leave it on the skin for up to 10 minutes. Now, obviously, this is when you can introduce a relaxation method. You can use cryo wands over the top of that hydration mask, or you can massage the scalp, you can massage the neck and shoulders, you can massage the hands. So there are different things that you can do during this 10 minutes while the B squared hydration mask is processing. For your finishing steps, you're going to apply the B squared recovery cream as your moisturizer, and then you're going to apply your antioxidant sunscreen. So this is the procedure for the new LumiZyme peel. Again, this PDF is in the chat. So just want to ensure that you have a copy of the protocol, as well as you have the full learning guide that has all of the power peels, and that you have the menu option from Ultraceuticals, what their suggestion would be for verbiage, timing, how they are going from having your performance facial treatment versus signature treatment. And now we have power peels that the guest would book a power peel, and then it is up to you as the esthetician to decide with the guest which peel you're going to perform during that time. Now, the Fusion series is where you are doing stacking. So that is where the LumiZyme treatment lives, is in that stacking, in that fusion category. There is the LumiZyme, there is the LumiZyme. So you can do this treatment not just with the brightening peel, but you can also do it with clarifying mandelic or your PHA or your lactic peel. You're always going to do your power peel first and then your azyme second. And that is what makes it the Zyme. So you have your LumiZyme, your LumiZyme, but the first one that we launched that we have had amazing results with is that LumiZyme treatment. Okay, let me see if I can pull up. Now here's an example of the menu that I was describing. So if I just scroll down, you have your performance facials. Now this is designed for the ultimate relaxation and skin rejuvenation. So it consists of Ultra A, Ultra B, Ultra C, your LumiBright. Then you can go into Z clearing facial experience. Now, this is where you are infusing a corrective or even two correctives into the skin. This is also where you can introduce the PHA peel. Then we go into the Ultraceuticals power peels, and this is where you're doing the Ultrazyme peel or the brightening peel, mandelic peel, lactic peel, PHA. So this is where you're doing a true peel. Then you have your clinical fusion series, which is what I was just talking about, where you are stacking. So you are doing a LumiZyme liquid laser, which is where you're doing the brightening peel along with your azyme. Then you have your Ultra Mandelizyme, which is doing your clarifying mandelic and then your azyme. So as you can see, as I'm just continuing to scroll down, this is where you are stacking. You can also include LED lighting. Right? So that is when the skin gets a beautiful glass glow. I mean, it is pretty phenomenal. My understanding is that when Tracy Beebe was performing this treatment on a guest, Dr. Jeffrey Heber was walking by and he was like, wow, her skin looks like glass. And that is where they came up with the Ultra Glass facial treatment. So I just wanted to do a quick check-in. Brittany or Caitlin, do you have any questions for me on the new menu? What Ultraceuticals is calling their treatments, why we have our performance facial, aka signature, why we have our power peels, why we have our clinical fusion treatments. Today, we particularly talked about and went through the LumiZyme in particular, with those brightening ingredients along with the azyme. One thing that I wanted to tell you as well, actually, before I go into asking questions, is the azyme has an enzyme in it called bromelain, and bromelain is derived from pineapples. It also has Ultra A. So if someone is wanting to come in for a LumiZyme or an azyme, or you're doing one of your performance treatments, it is recommended that you don't do anything that has a retinol if your guest is lactating or if they are pregnant. Outside of that, there isn't any peels that are contraindicated for pregnancy. So you can do a PHA, you can do a clarifying mandelic, you can do a lactic, you can do all of those, but you cannot perform the azyme because it includes retinol. And retinol is the ingredient that would be contraindicated for pregnancy. So are there any questions that I can answer before I move into post-care for peels? No? Okay.
I'm not seeing any in the chat or anything, so I think you are good to continue forward.
Okay. Okay. So again, here are some of those beautiful ingredients for the brightening peel: glycolic acid, citric acid, salicylic acid. Then we have our tranexamic acid, sodium lactate, and niacinamide. And then we're going to go into talking about contraindications. So as I had mentioned before, pregnancy would be contraindicated for the LumiZyme peel because of the retinol that it includes. So if you wanted to do the brightening peel by itself, it is safe for pregnancy. But if you're going to be doing the stacking of the brightening peel followed by the azyme peel, the azyme is what is contraindicated. Now, for all of our performance treatments, obviously you do not want to do a peel on someone who has a sunburn, someone who has psoriasis, eczema, or active rosacea, recent facial surgery, open wounds or skin infections, or active cold sores. Now, I like to point out active cold sores and talk about if a guest is coming in for peels and they are prone to a cold sore, it is recommended that they start to take their precautionary measures prior to. So if they take a lysine or if they take a medication to prevent the cold sore virus from peeking its head out, you want to take that the day of. Because remember, peels are creating a microscopic wound in the skin to heal and to regenerate. And so it can activate a cold sore breakout. So you just want to make sure that you're taking precautionary measures and that you're, just giving that little recommendation to a guest. If someone has an active cold sore, obviously, you don't want to perform the treatment because you don't want to spread the virus. If someone has been on Roaccutane within 6 months of taking the medication, so they need to have been off of the medication for 6 months in order to perform the treatment. Cancer or undergoing radiation therapy. Now, if someone is actively doing treatments, their body is going through so much trying to fight off those cancer cells. So I would go with more of a cleanse and B squared hydration mask. Treat them, with some calming, soothing, restorative massage movements that are light in pressure. So you just want to make sure that we aren't doing anything that is going to get in the way of their treatment. Tinnitus and cochlear implants is for the sono booster. So sono booster uses sound waves, and those sound waves create a vibration to either infuse ingredients into the skin or cleanse the skin. I like to think of it as being like a Sonicare toothbrush. It is the sound waves in your Sonicare toothbrush that is removing and knocking loose dirt, debris, and stains from the teeth. So that is what the Sono Booster in clean mode is doing for your skin. It's knocking things loose so that you can really deeply cleanse the skin. And then when you are using your Sono Booster in infuse mode, it is penetrating ingredients deeper into the skin. So if someone has tinnitus or cochlear implants, you can still perform the treatment. You just wouldn't do the infusion steps or the cleanse mode steps with your Sono Booster. Again, pregnancy, treat with caution. You can do any of the peels singular except for the azyme, and the LumiZyme has azyme in it. So that is why you would want to perform a different treatment. Some other considerations: diabetes, autoimmune diseases. All performance treatments seek medical advice as healing may be delayed or increase post-inflammatory hyperpigmentation. So again, this would be if they are taking medications that are making their skin more sensitive, like an antibiotic, then we're doing a peel. So do you see it could increase more inflammation. So it's just really important that we really understand and know what guests are taking with their medications and if that could potentially cause any contraindications for performing the treatment. A keloid scar, there isn't really much you can do for that outside of injecting it with cortisone. So obviously we do not do that as estheticians, so they would need to seek the help of a medical profession because trying to exfoliate a keloid scar is not going to break it down. Okay, So pre and post treatment guidelines. So before the treatment, you want to recommend using Ultraceutical home care products. Make sure that they are using a sunscreen daily. They need to stop using their Ultra A or their retinol products for 48 hours before you perform the treatment. And injectables. So Botox is 1 week and fillers is 2. So you need to make sure that they have not had any Botox within 1 week or any fillers within 2. Waxing and lasers, so no waxing or laser treatments for 2 weeks prior to the treatment. These treatments can make the skin more irritated and sensitive, which is why you want to ensure that it has been at least 2 weeks. Post-care. So clients may experience mild discomfort, redness, or flaking of the skin. Usually post-peel, all of them with the exception of PHA, there is a 5-day downtime. So what that means is no correctives for 5 to 7 days after you do a peel. If you're only doing your PHA or your brightening accelerator mask, then it's 2 days. So you can start using your correctives within 2 days. Now, when I'm saying correctives, I mean Ultra A, like a retinol, or your hydroxy acids, or a vitamin C. So if you want to use hydration correctives, then you can start using those right away. It's just your Ultra A, your Ultra C, and your correctives, but your Ultra B is completely safe and actually recommended post peel. Vigorous exercise or excessive heat should be avoided for 48 hours following the treatment. This includes steam baths, saunas, and hot showers. You want to not swim in a chlorinated pool for 48 hours following the treatment, and no waxing or laser treatments for 2 weeks following the treatment. And again, injectables. It is recommended to wait a minimum of 3 days before you have an injection post-treatment. Post-treatment products during your downtime. So the Ultra Cleansing range is safe. Ultra Hydrating Skin Mist. RED Corrective Serum is a beautiful corrective along with your hydrating B squared serum. Those would be beautiful in the recovery process of having a LumiZyme treatment. All of the Ultra Moisturizing range is safe, as well as you want to make sure that you're doing your antiox and your sunscreen every day. Another thing that is highly recommended is it is usually 2 days after you have a peel where you can experience some flaking. So this is very normal, and it's dry, flaky skin, and it usually is right around the mouth and the cheek area. This is very, very common, and the first thing that a guest is going to want to do is they're going to want to exfoliate it. And remember, there is no exfoliation products 5 days post-treatment. So it is recommended that they put on a hydration mask to hydrate the skin. And that will prevent them from wanting to exfoliate, scrub, or even pick at it. Those skin cells are still potentially attached to a healthy cell. And if you're scrubbing or trying to remove the dead skin cells, you may also be removing healthy cells. So that's why it's really important that you allow the skin to do its full processing time of 5 days. So it takes 5 full days for the peel to do its complete action. And so definitely, again, within 48 hours of having the peel, it is likely that the guest is going to want to do a B squared hydration mask. So definitely recommend that they take home a minimum of 1 mask. Okay, here are some real visible results. So as you can see on the left, there was quite a bit of pigment on the cheek and jaw area and along the forehead. And as you can see on the right-hand side, look at those results. Amazing results. Here's another. You can see, again, all of that pigment along the cheek area, the forehead, is drastically gone down. Here's another one. Again, you can see on the cheek area and just in general, even if you look at her nose, look at how much more soft and subtle her pores are, even. Also, I like to point out that fine line that she has on that forehead is also softened. So you can see how the skin is much more plump. It's much more hydrated. It's much more glowing, along with that pigment has drastically gone down. Again, before and after, we spoke about the before and after results, making sure that you are allowing that LumiBright or your LumiZyme peel to do its process of 5 days. So it's really important to ensure that you are going through that, allowing the skin to truly do its processing time. All right, so we have just under 5 minutes left. So just wanted to open the doors for if there are any questions or if there is anything else that you might want to add, Brittany, as the sales manager for Edgeless Beauty Pro.
No, Kali, I just wanted to thank you, of course, for your knowledge and passion about not only ultraceuticals, but just skincare in general. I think this was such a fantastic in-depth overview of just the first um, package essentially of the new treatment menu for ultraceuticals. So we're really excited to take a deeper dive in our future webinars. We will be sure to continue to send out the sign up form and the links to attend. And of course, this is recorded. So this will be something that we will pass on as well to review, share with team members, new team members, or team members who were not able to make it. So again, Kali, just wanted to thank you for not only your time, but your knowledge and passion for skincare and ultraceuticals.
Oh, well, it was definitely my pleasure. I love sharing information, particularly about anatomy and how these peels actually truly affect the different aspects of the skin for results. Because if we understand the why and we understand how it happens, then we understand so much more and we can do so much more for our guest. So thank you again for having me. I look forward to seeing you all at the next Power Hour session, which is going to be in 1 month from now. So keep your eyes peeled for that invitation. Look forward to seeing you then. Thanks again.
Thanks, Kali. Bye, everyone.